Can you start by explaining what medical cannabis is and how it differs from recreational cannabis?
Medical cannabis, recreational cannabis, they come from the same plant. They're the same thing. However, with medicinal cannabis, it's in a controlled setting, a controlled environment, a controlled pharmacy. Recreational tends to be more you buy off the street, you don't know really what you're getting, or you might be going to another state and getting it, which is illegal in the state of Utah. You have to have a medical cannabis card, and you have to be able to go to qualified pharmacies to get the cannabis. And there's different ratios, different types of strains. There's all kinds of different types of cannabis that the pharmacy will offer their patients for different kinds of treatments or different kinds of symptoms.
Perfect. Can you describe what are the most common conditions or symptoms that medical cannabis is prescribed for in hospice care?
Regarding hospice care, the main one is for control of pain. The other one would be nausea. Even outside of hospice setting, the number one reason why patients are on medical cannabis is to control pain. Nausea is another big one. We do use it quite often in patients who have different types of dementias, Alzheimer's disease. It does help control certain types of symptoms that come with those diagnoses. But pain is our biggest one that we use cannabis for to control because there are less side effects.
When you say less side effects, is it less side effects compared to other treatments like morphine and such?
Right, less side effects. If cannabis is used as it's directed, you're not overutilizing it. You're going off of what's recommended by the QMP and the pharmacist. You should not really be having euphoria or highs or other side effects that like narcotics can give. So you don't usually have nausea, rashes, allergic reactions, typically no, with cannabis like you could with opioids. So there's a lot more respiratory sedation with opioids versus cannabis.
What are some of the challenges or concerns when incorporating medical cannabis into a patient's care plan?
Well, we have to consider their condition, comorbidities, and other medications they're on. There aren't really any contraindications mixing cannabis with other medications, but there are some certain types of medications that can increase the effects of THC or increase the effects of that medication. So a QMP can look at the medications they're on and decide what medications are going to be okay with that or not. There are certain things that we have to monitor, like how well they're tolerating it, if they're on too much of a dose, or maybe if they're not on enough. So they definitely need some monitoring with the cannabis, and especially if they're in a facility where other people, like staff, are controlling how much they're giving.
How do healthcare providers ensure that the use of medical cannabis is safe and appropriate for each individual patient?
Well, in order for us to know if it's safe and appropriate, we usually will have a conversation with the patient and the family to discuss what their symptoms are, what other issues that they're having, the medications they're on, and then we can make a good medical decision if cannabis could be appropriate for them. And sometimes it's just a trial and error when introducing cannabis when they already have certain conditions and other medications involved.
So with that, what kind of feedback have you received from patients and families who have used medical cannabis for their treatment?
All of my patients I've been able to help get on cannabis have reported that it has helped in some capacity, typically controlling pain. Anxiety is not a qualifying diagnosis to be on cannabis. However, it does help with our anxious patients, specifically those who have those certain types of dementias. So,
how have you seen the prescription of medical cannabis change within the healthcare community over the years?
As far as, you being able to get on cannabis, the rules are fairly clear with that. They have not changed. There's always research going on right now with cannabis and what it treats. Or what it's used to treat for. So those are always really great to keep an eye on for. That kind of helps back up why you want to treat your patient with cannabis.
Perfect. Thank you so much, Cindy.
Thank you.